Button's article starts off with stating that the U.S. healthcare system has slowed in spending, with only about 17% of the America's GDP being spent on healthcare since the late 2000s. They discuss how this cannot be pinpointed to a patient group, geographic region, or specific type of care, but rather is a broader trend of the U.S. healthcare system as a whole. Button emphasizes a shift to value-based healthcare of both providers and payers as the main driver of this slowed growth. One piece of evidence contributing to the slowed growth that the article highlights is the stagnant to negative inflation-adjusted growth in payment rates. They also focus on the role of policy in various realms. Firstly, they highlight the role of policy to incentivize and disseminate innovations, which we also discussed the role of policy last week in the Herzlinger article, which creates barriers to innovation. While policy may slow innovation, institutions working towards value-based care may also take further considerations when looking into higher value technology and how it improves patient care. It may take loftier approvals to make higher cost capital purchases to get these innovations into the provider's hands. Button also showcases the increase in preventative care, specifically mentioning antihypertensive drugs to thwart the need for treatment for further developed cardiovascular disease, as well as potentially surgery. Lastly, Button also discusses the trend to outpatient surgery above inpatient care, which reduces the per procedure cost for patients and payers, as well as providers. An alternative explanation to account for slow cost growth are the advancements in telehealth. Receiving virtual care through a telehealth portal may prevent an office or hospital visit for a patient, which certainly would be a lower cost option. Additionally, there was a steep drop in elective procedures during the COVID pandemic. There may be a residual hesitation of U.S. citizens to receiving care that is carrying over from the pandemic, which would contribute to a slowed spending rate, at least since 2020. Lastly, an American shift in mindset and lifestyle could contribute to a slowed spending rate, specifically in diet, exercise, and smoking, which may trend and be main contributors to health complications. In terms of unintended consequences of the shift to value-based healthcare, those providers benefiting from a fee-for-service model may be discouraged from not experiencing as many profits. This may deter interested parties from getting into the healthcare industry and contribute to the already prevalent staffing issues across the healthcare system. Having a team-oriented approach to healthcare could also have an unintended consequence of burnout of the staff. Multiple stakeholders are now involved in decision-making, which may give the provider less autonomy over their decisions of care, as well as burnout in terms of constantly checking their work and getting approvals from other team members. While the idea of universal value-based care across the U.S. healthcare system seems ideal through Button's messaging, there are many implementation barriers as well to value-based care in terms of having a secured medical record system to share patient data across platforms and providers, as well as a standard rollout process of care across systems. Thank you.